Hi, this is Ian Wright, and I just want to do a little quick chat about gut bacteria changes and fibromyalgia. It's a piece of research that came out today and by a group from a university in Montreal, Canada, McGill, and the lead researcher was Amir Minerbi. And they've started to show that it's kind of important research, and that's why I wanted to talk about it, that they were linking chronic pain syndromes, especially fibromyalgia, with changes in the gastrointestinal biota, the biome, as in the natural bacteria in the gut, and the signature changes that happen in it in this chronic pain syndrome. One thing about this research is it's very hard to actually diagnose fibromyalgia. It's a very difficult diagnosis, mainly to do with the reports from patients. And I treat a lot of people with fibromyalgia symptoms, and there's definitely an autoimmune inflammatory situation as far as I'm concerned. So difficulty in discerning if it's chronic pain or it's fibromyalgia, it doesn't actually matter, because the important thing is this is the first time there's been some good qualitative research showing the link between the gut and pain and chronic pain. And there's a few different kind of hypotheses about what causes fibromyalgia. One of them is to do with a change in the processing of pain in the central nervous system. So there is almost a sensitization to pain. And there's another view which is quite widely held, which is to do with some sort of systemic inflammation, some inflammatory disorder which actually affects the nerves to the muscles. Now, to me, by how it feels, and I do things more on how they feel, it does feel like there is definitely an inflammatory autoimmune component to it. So what's great is that there is an increasing body of evidence that's showing that there is a change in the microbiota, the gut biome, in a variety of different disorders: metabolic, cardiovascular, neurological, and even especially psychiatric, as in disorders, as in schizophrenias, depression, anxiety type situations. So, suddenly everybody's focusing on the gut, and so they should, and it's very, very important. And I've talked about previously the whole gut-brain axis what's the most obvious one is in autistic spectrum disorders, and the increased evidence around that. And it's what we feel in clinic. We've been banging on about this for years now, that the relevance of the gut. So what's interesting is how pain is felt through the neurology is very close to other neurological issues and neuropsychiatric issues. So this whole area of the gut and the brain is really very important. So what has happened, it's like they've shown, it's quite an interesting piece of research where they've shown that there's an increase in certain types of bacteria and a decrease in other types of bacteria. So everybody has what's classified as the signature of their gut biome, which is to do with the different types and quantities of different bacteria in the gut, shown by when you do a stool sample. So interestingly, in this case, some of the ones that are decreased in fibromyalgia are actually increased in some of the rheumatological conditions like rheumatoid arthritis. So it shows it's possibly not a rheumatological condition, but it's a different kind of condition that maybe affects the nervous system. But the interesting thing about it is actually it might be an easier way in the future of diagnosing fibromyalgia is actually doing a stool sample and predicting what gut biome makeup, and that may be the future actually of diagnosis in fibromyalgia, which is an incredibly debilitating condition. But it does show that actually why patients do get some good responses by nutritionally, and I've talked about nutrition very recently in terms of nutrition and inflammation, by increasing polyphenols which come naturally in fruit and vegetable, can improve symptoms of fibromyalgia. It can definitely help those kinds of things. And I think that supports that when you increase the polyphenols, it makes for a different environment, which means different types and strands and threads of bacteria in the gut can thrive, or some are suppressed. So it changes that signature if you change your diet. So diet is going to be increasingly important in all diseases. So nutrition is really key, and getting that balance correct. So if you do have fibromyalgia, the first thing to do is increase your fruit and veg, keep it organic, very natural, and keep it very wide. And that's really quite important in terms of guts. Anyway, just a little bit of thing I just read and wanted to comment on. I wish you well.